doing on my car? Huh? What's that? You hear that? Hello?
Hi.
Oh.
This
Danny?
is Danny.
Oh, hi, it's Mary Ann. I think I was the first one to sign on, so.
Yeah. I think we're the first two. This is kind of new to me. I wasn't sure how this worked.
Did you use your phone or a computer?
Yes, I'm using my phone.
Yeah, I do that with, I participate in a weekly conference prayer call all across the United States, and so I'm a little familiar with this. We just didn't call it Zoom.
Oh, okay. Do you use it on the computer with with the video?
No, just the telephone is all I've used to.
Just audio conference, yeah.
Right. Yeah.
I downloaded the Zoom app, but I wasn't sure how that worked, so I just used the phone line.
That's, I think, the easiest, too, because I pulled up on my computer the notes that she sent us before so that I, when she starts talking, I don't duplicate notes.
That's the only thing on my phone. I don't have that pulled up. I guess I could go up to the computer and pull that up.
Well, I hope
probably would be smart to do.
Hey, everybody, it's Chelsea.
Hello. How are you, Chelsea?
I'm good. Who am I speaking with? I think I heard Danny.
This is Mary Ann, yes, and Danny's on.
I think we're missing Patty, and Patty's the only other person that accepted my invite. So we'll give them a couple minutes before we roll.
Okay.
How is everybody?
I'm doing great. I don't know, Danny might have gone up. He talked about going upstairs to pull something up on his computer, the notes, I think. So, I get Danny?
Yes, I'm here.
Oh, you are there.
Yeah. I was just trying to figure out how to put it on speaker.
Oh. Okay.
Maybe it is. It's just I could hardly hear Chelsea.
Oh. I hear her pretty good.
Okay.
Hey, Chelsea?
Yes, ma'am.
Okay, yes. All right, we hear you. Well, this is kind of nice. I'm sitting down with a cup of tea.
That sounds wonderful. I need to be with you.
You like jasmine tea?
I like any kind of tea. I don't discriminate.
I love tea. I don't drink coffee.
I wish I didn't. Everybody says that whenever they're older, they wish they hadn't have started to drink coffee, and I wish I hadn't have, because now life is just not the same.
I never did like it. I like to smell it, especially the grounds before it's perked, but never did like the taste of it. Ooh. Well, I'm trying to pull up notes, but it seems to me I must have lost them. The only thing I have is charts. Let's see.
I might be able to send them to y'all.
I saved this. I should have saved the other. Let's see. Oh, okay. I'm pulling up stuff now.
Would it help me? Do I need to send it to y'all, or are you good?
If you would send it to me, Chelsea.
I can do that.
Well, might as well send it to me, too, because I'm having trouble finding the notes. I thought I had them pulled up, but this is just charts.
Who just joined us? Patty?
Yes.
Hey, Patty.
How you doing?
Good. How are you?
Well, so far so good.
Good.
There I am. Hey, Elizabeth.
What, Patty?
I said, hey, Elizabeth. Oh,
Is Elizabeth here?
yeah. She's
Hey,
muted.
Elizabeth. She's muted.
Yes.
I don't know how to unmute her. I am going to email everybody these notes. Would that be helpful? I'm emailing Danny and Mary Ann. Patty, do you need the notes?
No, I think, didn't you send them out just a little bit ago? Because I printed
I
up.
think maybe, I'm not sure. I might have. Who knows? All right. Well, in the interest of everybody's time, I think we can get going. I just kind of saved some room for us to kind of remind ourselves who is who, because it's been a while. I don't even know the last time that we met. Was it in August?
Oh, well, was it at the summit? That was August, right?
Yeah.
Yeah. I have no idea. So I just wanted us to kind of reintroduce ourselves, and I will certainly start. So I am Chelsea Burrell. I'm the wellness manager for Harris Regional and Swain Community Hospital. So whoever wants to jump next.
I'm Patty Tibbery, working in substance abuse prevention and mountain projects.
I'm Mary Ann Burden. I'm on the board of Renew Bryson City.
Hey, Mary
I'm
Ann.
Danny.
Hey, Danny.
I'm Danny Burns. I'm a Swain County Commissioner.
Yay.
Hi.
Is Elizabeth, are you still with us?
Ooh.
Hey,
Hey.
it's Elizabeth. I had to use my phone. My audio on my computer's not working.
No, I'm sorry.
Oh.
Hey, it's Elizabeth Fleming from MAC.
Awesome. Well, thank you guys. I'm glad that we got to reconnect. I know we're missing Georgia and we're missing Joey from Macon County. I think we're missing somebody else that I have here. But nonetheless, we'll try and move forward in the interest of time. So I just sent out the notes. If I missed anybody, let me know. I'm just going to kind of breeze through these so we remind ourselves what we're doing. And if at any point you guys want to stop me, please do. So our action items were to get peer support specialists within health departments, if my memory serves me correctly. So our first step was to try and gather research on peer support specialist successes. That's hard to get out of your mouth. And so I think, Elizabeth, you said that you were going to look into the TRACE survey. Do they have those results yet?
So I was just talking to Jill about it a couple weeks ago, and they almost have it's a program evaluation for the TRACES program that was implemented in Madison, Mitchell, and Yancey County. So they should have that soon. She said by the end of the month. And then I asked her if I could share that with a group of community stakeholders. And then she said she would confirm with her director that that was indeed okay. So that's where we are with that.
Perfect. And so we can kind of keep that on the to-do. I'll adjust that in our notes to be at the end of November. So I'm going to go ahead and do that. November 30th. And then we were also looking at maybe some folks from MAHEC doing a literature review if they weren't super busy, looking at research on how different use of peer support specialists equates to various success. Were we able to do that?
I found out about that. So
no worries.
Jill told me So the dilemma is, though it's very clear about the efficacy of peer support related to health conditions, there's not a lot of literature to review or evidence behind it specifically related to substance use disorder.
Mhm.
And so I wanted to clarify for our request if it's of interest or need for it to be not specific to substance use disorder, or is what we already know from evidence and literature that it's working for health behavior change relevant enough? So that was the dilemma.
Elizabeth, is there any chance that some of the recovery education centers might have some data about that?
Yeah, I mean, that's the thing, is there's lots of good data from local implementation.
Yeah.
There's not a lot of data from evidence-based research projects that have been written on in a literature review around substance use disorder. So that's kind of the question, like, does it really make sense to try to pull a lit review that's probably not going to really help us one way or the other, or use our energy to work with like VIA or other groups who have been collecting data to say, what is the outcome around peer support regionally?
Okay, so what are our thoughts on that, everybody?
I know at the recovery education centers, they've used peers for quite a long time. And that's the model based on Marianne Copeland's program.
Yeah.
And so VIA might have some information to provide about the role and how many people use peer supports across their service area.
Yeah, I'm kind of the mindset that we don't even need to take the time or the hours to do a complete lit review, and that we have enough information to tell us that this is good, and we can pick some specific data from local implementation or state or North Carolina or regional implementation around peers that could hold up the reason why we are recommending this.
Mm-hmm.
No, I definitely agree. I think at this juncture within the year, it would be fair for all of us to be realistic and honest in saying that doing a literature review is a considerable amount of time that we probably all don't have, and it's not fair for all of us to put it on one person to do that. So I think that that's very realistic of using different resources that are already available just to kind of be able to explicitly say, look, this implementation works across these two platforms that VIA is doing, just to kind of instill that model. So I agree with you. Does anybody disagree, or what are our thoughts?
No, I was talking with, I talked with Shelley Foreman with VIA Health at one of our meetings, and she gave my number to Sarah Tennyson. Mm-hmm. And I'm not sure who Sarah is with. I didn't write that down. It's Sarah Tennyson at amchc.org. But Sarah did email me back and said that she's working with Cherokee, Clay, and Graham counties on a HRSA grant for 2 to 3 peer support positions. And that was a connection to reach out to from that Shelley sent from VIA Health.
Yes. And just for you guys to know, I serve on that same implementation team with Sarah and the 3 counties involved. And in addition to those peer positions, the health departments themselves are also looking at hiring peers. And so one of the things Sarah and I talked about was our thought that it would be great to have someone in the region who provided supervision and support to these different positions. And so she was very interested in that idea as well, that she felt like there wasn't a good mechanism in place for supervision if we started to get a robust peer group of folks together. So just wanted to give you guys that heads up. I had actually already talked to her about it.
Oh, good.
Awesome. Yeah. Did you have something, Danny?
I was just going to say, I did get an email from someone at DHH that North Carolina right now has frozen the training program for the peer support. Is that correct?
I've heard that as well.
Yeah, they said right now until they revamp that program or review it, and that the program at this point, now that's been a little while back. I'm not sure if that's been reinstated, but at some point the training had been frozen for peer support training. It was under review is what the email said.
Yeah, I had heard that, I think tentatively it was going to be closed for about a year. And, and they didn't seem to be concerned about it because so many people had gone through previous training programs and got certified, but now don't have jobs in the field. So they really thought that there might be a chance this would help open up some positions that those folks could get jobs.
Okay.
I'm super confused though, because if you go on the peer support website, there's training still happening. Like VIA has theirs listed.
I think they did their last one maybe in September or something like that.
Okay, it still shows that they have a December date coming up, but maybe it's just not updated. Well, if y'all have that information, if anybody can forward it, that would be super helpful. I had not heard that.
Okay, I did have an email, if I can find it, from, I forgot, I think the Shelley Caraway from Jackson County sent it to me.
Okay.
When I was talking to the different health department directors, she was just wanting me to be aware of that and said she had an email that she would forward and about the training program being frozen. But I'll have to look back and see if I can find that.
That would be helpful because that'll change a lot of what Graham, Cherokee, and Clay may be thinking about doing.
Yeah. So then I guess that begs the question for this group, because we're specifically targeting peer support specialists in the region, of how does that affect what we're trying to do, if it affects us at all?
I think, and this is just my best guess, is part of what, if we think about trying to get some continuum, some supervision piece, continuity between the counties, it seems like it would be important to talk to all the county officials about, making peer support specialists a part of their communities. And in doing that, if they say, okay, that'd be great, but we don't have a training to send them to, that could set us back.
Correct. I agree. And so that was kind of my thought of, well, if there's not a training, then that kind of puts us over a barrel, so to speak, if we're asking health departments to do this and then we don't have a resource to hand them for them to get somebody trained, or who knows. But then we also, the other thought is, if there is an abundance of people who have been trained and they don't have jobs, then that's also an opportunity for them to get a job.
Right.
So there's a two-edged sword there.
I would say, based on my experience with traces, though there may be a lot of people who've gone through the training, when we attempted to hire, we very rarely had someone come to us that already was trained and ready to be employed.
Gotcha.
So just we had to train every one of the people we hired.
Yeah.
Gotcha. That's good information to have. Well, I guess that's a good segue to even kind of consider if the health departments are interested. So, Danny, I'm so sorry. Danny, what did you find out from the health departments? Because I know you were diligent about speaking to all of them.
Yeah, I called and I think I reached all of them. I've got a little, it's been a while back. I think Clay County, I'm not completely positive I reached them. But in talking to all of them, I was kind of surprised. Of course, Haywood County has a pretty good, they have in place at the health department. They have lead workers with the police, 2 with the jail. So they have some going on. I was kind of surprised that Jackson County doesn't have anything in peer support, at least through the health department. Of course, they're in a transition right now, and in talking about space, if one could be provided, they couldn't guarantee a space at the health department because they're kind of busting at the seams right now. But Shelley Caraway did say that she would be open, and if there was something could take place, they would find a place for a specialist in their county. Macon County has quite a bit going on. They do have an alternative program called No Wrong Door, which is a part-time peer support. They have a telepsych program and some things going on. And it was kind of interesting in talking. It sounded like Graham County had probably the best thing going on in it right now. They have 3 to 4 peer support specialists, and it's called Celebrate Recovery. So that program, they just got a big grant to do this, but it sounded like of the counties that I reached, that Graham actually had a lot going on there, or a lot in the works right now for peer support. Of course, Swain County, we have none, and Cherokee County has some things in place, but most counties that I talked to would definitely be open to having, it's one of those things, you can't have too many peer support specialists in your county. But finding a location for them to house or office would have to be something else that would be worked out with each county.
Did you say Cherokee County did or did not have a peer support specialist, Danny?
I think they do. I was looking back at my notes here. I think Cherokee County does. And then Sarah Tennyson's working with them for 2 or 3 positions. I don't know how that's going. Like I say, this came through back in September the 30th. So it would probably good to reach out to her and see how that's progressing and what's come out of that with her working with Clay Graham and Cherokee County on that. But Graham County talked like theirs was already in place. Now,
theirs is already in place. From what I can tell of just kind of going to different meetings, not specifically for this topic, but they have shared the Celebrate Recovery and discussed their 3 peer support specialists that are there. They're not all there at the same time, but obviously whenever you have just 3 hired in general, then you definitely have a lot of support. And I don't know how many of you know about No Wrong Door in Macon County, but they do a phenomenal job. They do great work.
What was the name?
Do what now?
What was the name?
No Wrong Door.
Wrong Door. Okay, thanks.
Yeah, of course. No, she just started this year. She's not been up and running for very long. They just got office space. She just has 1 peer support specialist, but she's trying to hire a few more people, was what I heard the last time she spoke at a meeting. And they do all kinds of stuff, not just peer support specialist stuff.
I don't know if you know, Danny, that was actually started by Ronnie Beal.
Right. And I serve with Ronnie on the preservation board. I've got to know Ronnie very well. And I've talked to him about that. He was very instrumental in getting that started.
So to me, it sounds like a lot of counties do have resources.
I'll just share at our last RCOR meeting, when we were talking about these opportunities, David, the Health Department Director in Cherokee, he preferred that any of this work and employment of peers, that if there was a way to run it through a nonprofit or FQHC, that would be preferable, because I guess for health department, obviously, to assume a position, the benefits and the fringe and everything is can be quite a bit of money, and it may actually bust budgets that we currently have. And I believe he also said that it would require approval of, like, at the county level, because it would be adding a position ongoing. So those are just things we talked about. They were all very positive about the opportunity to have the peers through the RCOR implementation grant, but we just aren't sure quite like how to make it happen yet. It's kind of where we are. We have another meeting on Tuesday, December 5th, I think it is. Hold on, I'll tell you. December 3rd.
That was kind of my take in talking to all the directors that I talked to. Everybody was open, but not necessarily wanting to implement it into their workforce for it to be handled, as a regional thing.
Right.
And like I say, and some wasn't sure that it could even be housed, within their health department because of space constrictions. So.
Right.
This is kind of a sideline, but I got to hear Dan Pizzo from Buncombe County DSS present on Monday about the START program. You know about this, Elizabeth?
Yes.
Where they're using a clinician, a licensed addiction clinician, and 3 peer support specialists to help with DSS referrals for where substance use is an issue. And they've done phenomenal work in decreasing the amount of kids that had to be placed in foster care. And they've been working 2.5 years. And the START stands for Sobriety, Treatment, and Recovery Team. And Dan says we hire peers who have had experience having DSS involvement as part of their journey, and that they pay them well so that they'll stay and not be looking for other high-priced positions. But I think it was like they've cut their foster care placement by like 40%. I mean, it's been some astronomical.
Wow, 40%?
Yeah.
That's big.
Yeah, they said in Buncombe County that the program cost $200,000 a year, and in 2.5 years, they've saved over $1.5 million.
Ooh.
It's very effective. They've done a really good job.
It's an evidence-based program, or evidence-based intervention, based out of the University of Kentucky. And I kept thinking, for our smaller counties, this foster care stuff is killing us.
Yeah.
Oh, it's very hard on Swain County.
Yeah.
Because the county basically pays out all that.
Yeah. Well,
So is that something that is of interest, like moving forward with that program? I don't know how that program will look in smaller counties.
Well, he said that they have 4 social workers at DSS that get trained around substance use issues and around the START model. And he's the director of those other three. And then they contract the clinical and peer services.
Oh.
So that would be a conversation for a DSS, it sounds like.
Yeah. But, I think this has a little more bite in terms of getting community stakeholders like county commissioners engaged, because it does provide a significant cost savings.
Right.
Yeah.
Wow.
Okay. So, I mean, from my perspective, looking at it from, saving money, all of that fun stuff, I think that would be a good model to try and propose to counties in Western North Carolina. What are our thoughts about moving forward with something like that?
Sounds good to me.
Yeah, it sounds like it's already performing program that you can show statistics and they can see how it's working.
Yeah.
Rather than a new startup program as such.
So I wonder if Deborah's group would be willing to kind of host a little like lunch and learn or something and have the START group come over and present about the program. And
I think that would be an awesome idea. Who do you have in mind as an audience? Us, or are you thinking like including DSS directors or who?
Directors and maybe one of the social workers and certainly county commissioners, because there will be initial startup. I mean, they can talk about all that stuff though and give the statistics of the effectiveness.
Yeah.
Yeah.
One of the things I would throw out as you're thinking about this is that a key piece to start is access to treatment. And so a big part of how this is working is that a lot of the moms need access to medication-assisted treatment and recovery services. And so just doing START won't be successful unless there's a network of providers, but maybe it would be the start of getting people more on board into a plan. So when you have the lunch and learn, I would also consider inviting like Melinda Ramage and her team from Project Cara, and other key folks to just hear about it so that you can start to really brainstorm what's needed in terms of community resources for treatment and recovery for this to be successful.
And that certainly would give it infrastructure if we wanted to look at some type of peer support supervision. As the counties build into it, maybe, some counties, it might take 3 or 4 years before they'd be open to it and had treatment. But if a provider has a contract to do services in Swain County, I don't know that VIA has to be involved, which might make.
So in terms of the comprehensive care that a perinatal patient might receive, so a pregnant woman from Project Cara is not necessarily billed through VIA, it's billed through medical services, through Medicaid. So, but there's also a great number of those moms who also need IOP and SACOT and different levels of care. But the key piece is the peer, right? So it's the services and the peer that make the START program super successful. And I think it also helps hone in our group's recommendations so that it's not so giant and difficult to kind of pinpoint. So if we targeted working with families involved with foster care through the START program, that hones our idea down a little bit, making it a little bit more workable. So I like it.
Yeah, and one of the requirements is that one of the children in the family has to be under the age of 5. So that actually puts a nice container on it. And that has a lot to do with the model. The efficacy of the model has certain requirements, and they can go over that if we can have them come and do a presentation for a group.
Mm-hmm.
Well, I mean, I think just the presentation and the lunch and learn is a good opportunity for information and education, and people can kind of decide for themselves what that looks like in each county, right?
Yep.
So I think that that's a good starting point, at least, just to provide that information, because a lot of us didn't even know about that until you shared it, Patty. So I think that's a great starting point.
Yeah. And would we want to consider, I know this is kind of a stretch, but school superintendents as well? Because when those kids are jumping around from mom and dad to foster care to family to the impacts where the kids are in school.
Yeah, I think that would be good. And just on one note, and Chelsea and all of you may know, that Swain County just got, Blue Ridge Health got the contract. They will be working in our school system and setting up a clinic. They will have dental. Also, the dental bus will be there, and they will have a provider in our health department, I think 3 to 4 days a week, which is going to help with our health department. It was, they were awarded the grant just recently, and we'll be setting up, just as soon as the school gets this renovation project done, as the way I understand it, they will have a small medical clinic on campus where children won't have to leave the school to go for doctor visits. They can do a lot of the things right there and not miss school. And it has a component for the mental health and behavioral disorders. They will have counselors for that also as part of that.
Awesome.
Okay, so moving forward, Patty, do you feel like you could set up a lunch and learn? Is that something in your capacity, or how can we help you with that?
Well, I think what I'd like to do is call Deborah and ask her if this is something that they'd be willing to do under their umbrella.
Yep.
And I might try to steal Kay McConnell to help me look at getting pieces and parts together. But it certainly would be nice if, like Danny, if there's a way you could be the person to invite the county commissioners and.
Yes, definitely.
If we want to make a kind of thorough list about who we want at it.
So my question is, do we want to do this county by county? Are we wanting like a very, very large, because I'm envisioning there's going to be a lot of stakeholders at this, right? So you're talking DSS directors, you're talking school and superintendents, commissioners. So if you have however many counties, I don't remember what our group decided upon county-wise. If we're, what did we decide on? What are we in county-wise? Are we all 8? Are we all 16? Are we doing 4 or 5?
Oh.
I think that it goes with, well, I don't know that it has to, right? But the conference was 7 or 8 out
7
west,
western
the far
counties.
west. Yeah. So
yeah, it's usually considered as 7 counties. Haywood West.
Yeah, Haywood West. Yeah.
Mm-hmm.
So do we want to do a big event where we invite all 7 representatives, like all 7 county representatives, or we want to do county by county?
I think a big one might be a little more helpful from the sense that if I'm from Jackson County and you're from Swain, you might ask a question that I would not have thought about, but is very helpful for me to be able to take back.
Yeah.
Oh,
I think that's good.
it's a good thought.
Also, I don't know that we could convince someone to come out and do this 8 times. I mean, maybe, right? So we have to check their schedule. Yeah.
100%. Okay. So Patty, if you will talk to Deborah, and then maybe each of us could come up with people we feel like should be at the table or would be at the table.
Okay.
Just to kind of generate like a quote unquote guest list. And we can kind of move from there. If we want to move forward by email, does that work for everybody, or do we want to schedule another Zoom call?
Oh, email's fine with me.
Email works for me, yeah.
Yeah.
So Marianne, you've been kind of quiet. Are you okay with all this?
Who did you
Marianne?
say? Oh, me.
Yeah.
No, I've been speaking up here and there. Some of it was staticky, though, but I think I got most of it.
Okay.
But no, yes, it sounds great. It sounds like we're on the right track to me. If
Sure.
they can come out and do that, the start model, that would be wonderful.
Yeah, I think it would be really interesting to have that dialogue, because even if one starts, the others can watch and see how it goes.
Right.
Yes.
So does the email work for you, Patty, and you, Elizabeth?
Yeah.
Yes.
Okay. Beautiful. So then we can just move forward by email. Do we want to set a timetable on this of when we want to have this kind of scheduled, set, maybe yes or no?
Yeah, I'll contact Deborah, and maybe after I get a yes or no from her,
Yep.
you guys know, and then we can see if we need to step forward or punt or what to do.
That sounds great. So let's
Sounds
say, because we're getting into the holiday season, everybody's going to be traveling and do various things. Let's say we have an answer from Deborah by January 1st, and we can kind of reconvene and move forward, or we can back up and, like you said, punt again.
Sounds good.
Yes.
Mhm.
Perfect. Well, I appreciate everybody's time. I have some notes here. I'll type up these notes, and I'll certainly send them to everybody. Does anybody have anything else they would like to share?
Yeah, thanks
No,
for
this
opening.
is good.
No, I appreciate all the hard work of everybody. I've not done anything but kind of learn.
That's all part of it.
Exactly
Yeah.
right.
Yep.
Okay, well, if all hearts and minds are clear, then I will send you guys this email, and I will probably talk to you in the new year. So happy holidays, everybody.
Happy holidays to
Thank
you.
you.
Same.
Happy
Yes.
holidays. Bye now.
Bye, guys.
Bye-bye.